Hello friends, welcome to Physio eLearn. I am Dr. Varun Jaiswal, and in this video we are going to discuss about follow-up of Dallas bedrest study. Now before we start discussion of follow-up of Dallas bedrest study, let's discuss in short what was Dallas bedrest study. So Dallas bedrest study was done in way back 1966 where a group of researchers they tried to prove the harmful effects of bed rest. They wanted to prove that how harmful the bed rest is for your cardiovascular capacity or cardiovascular conditioning. So what they did, they just enrolled 5 individuals who volunteered for their research, and they asked them to take bed rest for a stretch of 3 weeks, and no other physical activity was allowed to them. So before they started their bed rest, there were a few parameters they measured was VO2 max, their cardiac output, their heart rate, stroke volume, and body composition. So these parameters were measured, and the volunteers was put into the study, and their job was to just take the bed rest for 3 weeks. And after 3 weeks, when they tried to measure or when they measured their parameters, the results was shocking. So if you see these 5 individuals, 1 2 3 4 5, so their VO2 max was dropped drastically. Okay, you can see all the VO2 max has gone down. This is the parameter of 1966. Okay, before baseline and after the bed rest. So after the bed rest, there was drop in the VO2 max. There were again, you can see in the bar diagram, there is drop in the VO2 max. You can see after the bed rest. Okay, there is drop in the maximal cardiac output after the 3 weeks of bed rest. There was drop in the stroke volume after the 3 weeks of bed rest. So they published this study in 1968, and after 30 years of completion of this study, there were again few researchers. They have took the follow up of the same volunteers who were enrolled in the Dallas Better study in way back 1966. The same individuals were enrolled in the year 1998. Okay, sorry, 1996. And these individuals, they tried to measure again the same parameters, and they tried to compare it with after the bed rest parameters. So if you can see in this again in this graph, okay, I'll just zoom it. Okay, so this is the point of baseline before the bed rest. This is the point of VO2 max after the bed rest, and this is after 30 years of measurement. So you can see the 30 years of aging. The 30 years of aging was more detrimental. The 3 weeks of bed rest is more detrimental than as compared to the 30 years of aging. So I'll repeat, the 3 weeks of bed rest were more detrimental than the 30 years of aging. So if you can see the point of baseline, okay, the baseline is here, and this is after 3 weeks of bed rest. So the drop in the VO2 max is more as compared to the drop from the baseline to after the 30 years of aging. So here in the follow-up study, it was very well proved that the 30 years of aging is less detrimental than 3 weeks of bed rest. So aging is thought to be, because of aging there is decline in cardiovascular conditioning, but more than aging, the bed rest is more responsible for declining in your cardiovascular capacity. You can see in all the figures, okay, you can see here cardiac output was dropped more as after 3 weeks of bed rest than which is dropped in after 30 years of aging. Okay, even the stroke volume was surprisingly maintained, because there was drop in the heart rate. So to maintain the cardiac output, the stroke volume, there was less drop in the stroke volume. Okay, so by this follow-up study, it is well proven that the bed rest is more detrimental. So here there is an evidence that bed rest should be prescribed very selectively, and there is a strong message for all the physiotherapists that they should start early mobilization to the patient, because here you have seen that how detrimental the bed rest could be for their cardiovascular capacity. So as soon as possible you have to start mobilizing the patient. So Dallas better study and a follow-up of Dallas better study has proved that the bed rest is very much harmful for the patient's cardiovascular capacity. So I hope you have taken the message that early mobilization is very important. Thank you so much.